Until someone has had Achilles tendon pain, they don't understand just how debilitating it can be. We don't realize how much we take simple things like walking for granted. In this video, you're going to learn what causes Achilles tendon pain, what treatments do and don't work, and get our top tips to help it starting today. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, this information is meant for education and demonstration purposes only. With that out of the way, let's get into it. There's an increasing body of evidence that injuries like Achilles tendinitis involve very little inflammation. This is why it is now recommended that itis, meaning inflammation, is dropped and replaced with the more appropriate term Achilles tendinosis or tendinopathy. While it may seem like nitpicking, the implications for treatments are dramatic. The Achilles tendon is the terminal end of three calf muscles, the gastrocnemius, the soleus, and the plantaris, with the plantaris being absent in about 8 to 12% of people. The Achilles tendon attaches to the posterior side of the calcaneus or heel bone, and at its attachment to the heel is the subcutaneous bursa and the retrocalcaneal bursa, which help to reduce friction between the tendon and the bone. It is also covered with a tissue called the paratenon. Assuming pain referral sources such as the low back have been cleared of involvement, there are three main culprits for pain in the area of the Achilles tendon: paratendonitis, bursitis, and Achilles tendinosis. Paratendonitis is a place where true inflammation can occur. It is an elastic covering that decreases friction and allows free movement of the Achilles tendon. When it is inflamed, it produces tenderness to touch, poor tolerance to activity, slight swelling of the Achilles tendon, and can cause crepitus or grinding sound when you move your foot up and down. Bursitis is inflammation of the bursa sac, and there are two involved with the Achilles tendon: the subcutaneous bursa, which sits under the skin but over the Achilles tendon, or the retrocalcaneal bursa, which sits between the Achilles tendon and the calcaneus or heel bone. A bone spur called the Haglund's deformity is often blamed as it is assumed that the retrocalcaneal bursa is being compressed between the bone and the tendon. However, they show up almost as often in people with and people without pain, 65% versus 55%. What may be more of a factor is not the presence of the spur, but its length. People with pain tend to have a bone spur length of about 13 millimeters, half an inch, or higher. Statistically, the most common cause of pain in the Achilles tendon is from tendinosis, and there are two main locations it can occur: mid-portion and insertional. Insertional typically runs around 2 to 3 centimeters up from the heel, and the mid-portion is above that. Very few inflammatory biomarkers are found in painful Achilles tendons, but instead show signs of degenerated collagen fibers. Achilles tendinosis has increased immature collagen fibers that often do not link together, which limits their ability to handle loads. They have increased ground substance, which is the stuff that sits in between the cells, and new blood vessels that are disorganized and do not contribute to healing. Tenderness or pain with squeezing or pressing on the Achilles tendon does little other than determine that pushing on it is painful. It adds minimal value in determining the cause or the treatment for Achilles tendinopathy. Signs of tendinopathy or tendinosis on imaging do not necessarily indicate the presence of Achilles tendinopathy, and vice versa. For example, the reported percentage of pain-free tendons with signs of Achilles tendinopathy on imaging can be up to 35 to 52%. And the percentage of painful tendons without signs of Achilles tendinopathy on their imaging occur up to about 19% of the time. What that means is that the presence or absence of tendinopathy in ultrasounds and MRIs is fairly irrelevant to whether you have pain or not. Let's start with what are believed to be factors that cause Achilles tendinosis but in actuality do not. Overpronation, supination, flat feet, high arches, rotated hips or pelvis, hip misalignment, leg length discrepancies, especially below half an inch, have no greater risk of developing Achilles tendinosis than anyone else, despite what people will claim. On every forum I read, people are always asking what shoes they should buy, when the reality is that it only matters if you're changing your shoes dramatically and for an immediately increased period of wear. I'm talking about going from wearing a sneaker to all of a sudden wearing heels 8 hours a day. If changes are introduced slowly, the body and the tissues will adapt to the new stresses. so switching to heels but gradually increasing the wear time over several weeks will be fine. This is another classic condition blamed for Achilles tendinosis. Tightness is really just a sensation, and stretching only alters that sensation, giving the perception of being looser. Stretching itself is a misconception we'll cover in another post, but stretching does not actually change tissue length, at least not permanently. It can temporarily decrease the stiffness of tissue for a few minutes. Stretching can be part of a treatment plan, but it should be done in a specific way and with the knowledge that you're not trying to lengthen the tissue, it just doesn't happen. But understanding that it's about the application of tensile load through the tissue. This is kind of a risk factor, and it's more about the composition of weight versus the pure amount of weight. Weight is usually gained gradually and the tissue will adapt to tolerate the increased stress. So there must be another variable involved, and it appears to be body composition, which we'll talk about in a minute. What are actual risk factors for Achilles tendinosis? Fluoroquinolones are antibiotics that are typically used to treat a variety of illnesses such as respiratory and urinary tract infections. These medicine names typically end in the word fluoxetine, but common names include Cipro, Factive, Levaquin, Avelox, Noroxen, and Floxin. People taking these medications have a 2.5 times increased risk of tendon pain and a 4 times increased risk of rupture, and should be avoided if possible. As mentioned earlier when talking about weight, body composition plays an important role in tissue's tolerances to stress. With increased body fat, there is an associated chronic low-level inflammation that has been shown to weaken collagen. This results in lowering a tissue's tolerance to stress, and thus an increased likelihood of damage. This could reasonably explain why the prevalence is higher with obesity. It's important to note that people can also have low body weight and have high body fat. It is not the stereotypical obese person problem. The good news is you can address these risk factors today through lifestyle changes with nutrition and exercise. Systemic diseases and disorders play a role in decreasing the tolerance of connective tissue to forces. Factors that affect microcirculation of blood, such as hardening of the arteries, abnormal lipid profiles, tobacco use, and diabetes, have all been linked to increased risk of developing Achilles tendinosis. People with immune system disease such as rheumatoid arthritis and ankylosing spondylitis will also have an increased risk due to their effect on collagen. The common variable in all tissue injury is that a tissue's tolerance to stress has been exceeded. This is usually the result of a significant fluctuation in activity level, as seen with New Year's resolutioners that get injured at the gym the first week of January trying to do too much too fast. Inactive or sedentary people's tissue tolerances decrease with decreasing activity. In having a lower threshold to tolerance, even slight fluctuations in activity level can surpass a tissue's tolerance and cause injury. Combine that with either a systemic disease or high body fat composition, and the deck starts to be stacked against you. A simple task like climbing stairs or going for a short walk may be too much. This is why it is so vital to be active and gradually progress exercise. It increases strength and raises tissue tolerance to stresses and activity. Every day you put off changing your nutrition and exercise habits is one more day in the wrong direction. Improved nutrition, exercise, and the associated changes in body composition all help decrease chronic inflammation levels and improve not only tissue health, but health in general. Thanks for watching. Before you head out, please hit that like button, share us with your friends. Be sure to click the subscribe button and the notification bell so you don't miss our video on the best exercises for Achilles tendinosis, and we'll catch you on the next one.